This is the specimen of stomach. The stomach is a muscular bag. It is the widest and most distensible part of the digestive tube. It stores the food and helps in the digestion of protein, carbohydrate, and fat. The stomach lies obliquely in the upper and left quadrants of the abdomen, so that it occupies the left hypochondriac, epigastric, and the umbilical regions of the abdominal cavity. The stomach is roughly 25 centimeters long. When empty, the stomach is J-shaped. As you can see, this is the J-shaped stomach. When it is slightly distended, then it is piriform in shape. And in obese person, it is almost horizontal. The capacity of stomach is about 1.5 to 2 liters in adults. It is about 1 liter, then less than 1 liter at puberty, and about 30 ml at birth. The stomach has 2 orifices. This is the cardiac orifice. The cardiac orifice is continuous here with the lower end of esophagus. The esophagus opens into the stomach at this orifice. And below, this is the pyloric orifice. Here, the stomach will continue with the first part of duodenum. Now, in addition to the 2 orifices, the stomach has 2 curvatures. This is the lesser curvature, or the right border. And this is the greater curvature, or the left border. And there are 2 surfaces. This is anterior or anterosuperior surface, because the stomach in anatomical position faces anteriorly and superiorly, whereas this is the posterior-inferior surface behind. It faces posteriorly and downwards. Now this notch here, where the esophagus is opening into the stomach, this is the cardiac notch. This is the cardiac notch. And lower down here, the most dependent part of the lesser curvature, this is the angular notch, or incisura angularis. So we draw 2 imaginary lines here. The first imaginary line is a horizontal line here at the level of cardiac notch. And the second imaginary line from the angular notch going downwards and to the left. So this second imaginary line divides the stomach into 2 parts. The part above it, the greater part here, is a cardiac part, and the part distal to it, this is the pyloric part. Again, the cardiac part is divided into 2 parts. The part which is above the first imaginary line, which projects above as a dome-shaped part, this is the fundus of stomach. So this is the fundus. The fundus is usually filled with gas, which is seen on X-rays beneath the left dome of diaphragm. Between this first imaginary line and the second imaginary line, this part is a body of the stomach. And the part distal to the second imaginary line, this is the pylorus, which is again divided into 2 parts. This is the pyloric antrum and the pyloric canal. Now here, this part is a pylorus. On the surface, you can see there is a circular groove or constriction. This indicates the location of the pyloric sphincter. Beneath the pyloric sphincter is a thickening of smooth muscle in this part of the stomach. In the living, there is a vein running anterior to this pyloric constriction. This vein is the prepyloric vein of Neon, which runs anterior to the pylorus. Now in the interior of the stomach, we can see such irregular mucosal folds. These are known as gastric rugae. The gastric rugae is almost horizontal along the lesser curvature. So here it is known as a gastric canal. Now coming to the relations of the stomach, in the peritoneal relations, along the lesser curvature is attached the lesser omentum. Within the two layers of the lesser omentum run left gastric artery from above and right gastric artery, which is running up. The left and right gastric artery anastomose with each other along the lesser curvature of stomach. Whereas along the greater curvature, in the median part of the greater curvature is attached the greater omentum. And along the greater curvature, within the two layers of the greater omentum run the left gastroepiphytic artery, which is a branch of splenic artery, and the right gastroepiphytic artery, which is a branch of gastroduodenal artery. And the two gastroepiphytic artery anastomose with each other along the greater curvature within the greater omentum. Also, there is reflection of peritoneum from stomach to the spleen. This forms a double-layered fold of peritoneum, which is known as gastrosplenic ligament. The gastrosplenic ligament contains the left gastroepiphytic artery and the short gastric arteries, which will supply merely the fundus of stomach. Also, the peritoneum reflected from stomach at this part up to the diaphragm is known as a gastrophrenic ligament. So these are the main peritoneal relations of stomach. Now coming to the visceral relations. The anterior surface of stomach is related to the posterior surface of left lobe of liver in this area. The diaphragm in this area. And the rest of the anterior surface is related to anterior abdominal wall. The diaphragm separates the stomach from 6 to 9 ribs, left pleura, and the pericardium. Coming to the posterior relations of stomach, the structures which form the posterior relation of the stomach are collectively known as the stomach bed. So in the stomach bed include the diaphragm, the left kidney, the left suprarenal gland, and the body of pancreas. And attached to the anterior surface of the body is the transverse mesocolon and the splenic artery. All these structures are separated from stomach by the cavity of the lesser sac. Whereas on the left side there is one more relation, that is the spleen. The spleen is separated from stomach by cavity of greater sac. Now coming to the blood supply of the stomach is mainly supplied by branches of the celiac trunk. The celiac trunk location is here. The celiac trunk gives the left gastric artery, which enters the lesser omentum and runs along the lesser curvature of the stomach. And here it anastomoses with the right gastric artery, which is a branch of hepatic artery proper. Whereas along the greater curvature, the left gastroepiphytic artery, which is a branch of splenic artery, which anastomoses with the right gastroepiphytic artery, which is a branch of gastroduodenal artery. The fundus is supplied by the short gastric branches of the splenic artery. Now coming to the nerve supply of the stomach is supplied by both sympathetic and parasympathetic nerves. The sympathetic nerves mainly come from T6 to T10 segments of the spinal cord. And these nerves reach by the greater splenic nerves and the celiac and hepatic plexuses. Stimulation of these sympathetic nerves will lead to contraction of the pyloric sphincter, and these nerves are also vasomotor, and they also carry the pain sensation from the stomach. The parasympathetic nerves are from the vagus, left and right vagus nerves. The left vagus becomes an anterior gastric nerve, and the right vagus becomes a posterior gastric nerve. The parasympathetic nerves relax the pyloric sphincter and also cause increased secretion of the gastric juice, which is rich in pepsin and hydrochloric acid. So sympathetic stimulation mainly is vasomotor. It is motor to the pyloric sphincter, but it is inhibitory to the remaining of the gastric musculature. So it will not allow motility of the stomach. Whereas stimulation of the parasympathetic system will relax the pyloric sphincter and contract the rest of the gastric musculature so that whatever contents up there in the stomach will flow towards the duodenum. Also, the parasympathetic nerves are secretomotor, which will supply the various glands so that there is secretion of gastric juice rich in pepsin and HCl. Now coming to the lymphatic drainage, we can divide the stomach into 4 lymphatic territories. So if we draw one line here, the other line going upwards, up to the fundus, and one line from this line going to the left. So there are 4 lymphatic territories. There are 4 lymphatic territories. This area drains into pancreaticosplenic lymph nodes. These lymph nodes are present along the splenic artery behind the stomach. From the pancreaticosplenic nodes, the lymph will go to the celiac nodes, which are located around the celiac plexus. This territory drains into the left gastric lymph nodes, which are located along the left gastric vessels. From here, the lymph will go to the celiac nodes along the colectron. This territory drains into the right gastroepiploic nodes, which are located along the right gastroepiploic artery, and from here the lymph will go to subpyloric lymph node, which is at the angle of the first and second part of duodenum. From here, the lymph will go to the hepatic, and from hepatic to the celiac nodes. Whereas this last territory, that is this territory, will drain into subpyloric lymph nodes, and from here to the hepatic and celiac group of lymph nodes. So eventually all the lymph from the stomach is draining into the celiac group of lymph nodes, which are located along the celiac trunk.